Welcome to the Embodiment of Sexual Pleasure After Trauma, presented by Andreya Jones. Dr. Andreya Jones is an AA-SECT certified sex therapist and owns a private sex therapy practice in Camp Hill, Pennsylvania. She works with individuals and couples of all genders and relationship structures. Today, Dr. Jones will address some of your more pressing and private concerns around sexual health, intimacy, and sexual pleasure after diagnosis. Thank you, Dr. Jones, and I'll turn it over to you now.
Thank you so much for coming today. It is such an honor for me to be here, to be able to share my experiences with everyone and my passion, which is sex therapy. So today we're going to talk about the embodiment of sexual pleasure after trauma. So I just wanted to give you all a little bit of information about me. I'm a doctor of clinical sexology. I'm an ASECT certified sex therapist and a licensed clinical social worker. I own a private sex therapy practice in Camp Hill, Pennsylvania, and I work with individuals and couples of all genders, sexual orientations, and relationship structures. I work with individuals who have experienced and survived sexual, emotional, medical, birth, and psychological and physical trauma. And before I kind of dive into what I want to talk about today, I just want to make sure everyone understands that the information I'm going to share today references my personal experiences, as well as the experiences of some of my clients. So not all of my clients, obviously, but everyone is entitled to have the beliefs and values that they want. I'm simply sharing my experience and the experience of my clients. And I'm going to do something a little bit different today, which is I'm going to try to be transparent and vulnerable as a clinician. And I'm hoping that by sharing my personal story with you guys, it will be more impactful. And I just want to be different in the sense of being honest and transparent, because I think a lot of times as clinicians, we feel like we need to be shut off. And that's just not me. Especially as a therapist. So to begin today, and I know you guys are all at home and this might be a little weird, but I just want to ask you to close. I want to ask you to just look around your room or your living room or wherever you are. And I want you to notice everything in the room that is purple. And just make note of everything. And then what I want you to do is I just want you to close your eyes. And I want you to tell me, or not out loud, obviously, since we're doing this over Zoom, but I want you to think about what was yellow. And because I had asked all of you to think about what was purple, my guess is most of you didn't notice what was yellow. So you can open your eyes. Look around your room and notice, oh, there's a yellow book and I have a yellow painting over there. And this is an example of something that I do with my clients when they begin their journey working on trauma, because trauma is like purple. And when we've experienced purple, we begin to look for all of the purple in our world. We're ready for purple. We're prepared for when the purple is going to show up. But what happens when we focus on purple is that we miss out on the yellows and the greens and the blues and the pinks. And life is not just about purple. It's about the entire rainbow. And my goal as a clinician, as a therapist, is to help my clients acknowledge the purple, process the purple, but also make space for all of the other colors. And so as we move forward, I just wanted you guys to think about that. So I'm going to start off by talking a little bit about my own personal story. So my sexual trauma began at the age of 18 months. And I grew up in a really conservative Christian community. And so the messages that I received about my body and about who I was and about my sexuality was basically that everyone was entitled to my body. I did not have a voice. I wasn't able to say no. And honestly, I didn't even question what was happening to me, the abuse or the trauma, because it was part of my everyday life. It was totally normalized. And as I look back, I realized that my body felt unsafe. I felt uncomfortable and often scared. Um, but again, this is all I had known, so I thought this was normal. And I simply believed that my body's purpose was to give emotional, physical, or sexual pleasure to other people. And as I grew up and I began to date and I began to get into relationships and friendships, I found myself gravitating towards abusive relationships because I had been conditioned to believe that abuse was love. So my body held the emotional and sexual pain that I had experienced, and it began to shut down the older that I got, the more relationships I was exposed to. And I began to experience this connection between, being able to experience any connection between my body and myself almost became impossible. And so, what often happens with people who have experienced any form of trauma is that we see this disconnect between the brain and the body, right? And that's because we go into survival mode and protection mode. And so, when I was touched or when I was in unsafe situations, my body would begin to tingle and lose all of its feeling. And my skin became extremely sensitive to touch to the point where it became painful to be touched, and just like everyday touches. So if I was playing on the playground with my brothers and one of them accidentally kind of like touched me on the arm, where normal people wouldn't experience pain, I would experience pain. And so everyone would always say, like, you're just super sensitive. Now, as a sex therapist and as someone who has done tremendous work on understanding trauma in myself and in my clients, I realized that that was my body holding that trauma, always being ready for what was going to happen next. And when I became sexually active, or at least consensually, and I began engaging in what I thought was consensual sex, I experienced brief moments of pleasure, but then I would feel overstimulated by whatever touch was happening. My body would go numb, and I experienced pain during digital or penile penetration. So, this brings me to this big word in the world of mental health and therapy, which is trigger. I'm sure you hear lots of people say, oh, that was triggering, or I felt triggered. So, what is a trigger, right? So, a trigger is, by definition, to cause an intense and usually negative emotional reaction, right? And triggers are automatic responses connected to past abuse that can suddenly rush into the present. Triggers often bring up images or feelings from the past. So if I experienced trauma on a bike, let's say I fell off my bike as a kid and I broke my arm, and that created trauma for me. The next time I get on a bike, even if it's like 5 years later, or I'm around a bunch of bikers, I might feel triggered because of that trauma. But triggers often have this negative connotation, like, oh no, I'm triggered, or oh, I felt triggered and that was really bad. But as a therapist, I really want us to consider what would happen if we reframed what being triggered meant. Instead of being this negative thing, what if we could just get curious about triggers and look at them as signs telling us what needs attention and healing? And triggers, like trauma, are held in the body, right? And they need to be acknowledged and processed in order to be released. most people who've experienced trauma want to avoid that trauma. They want to avoid triggers or feeling that pain or feeling uncomfortable when they are triggered or when the trauma comes up for them. But when we avoid it, right, it just gets louder because the body is holding the trauma and the trauma has to eventually come out. So if we put it in a box and we put it on a shelf and we avoid and avoid, right, we can do that for a short period of time. And some people are even able to do that for years, but eventually it's going to come out, whether that's through illness in the body or anxiety or depression. It always has to come out. So the best thing that we can do with trauma or triggers is to acknowledge it. And triggers are often connected to emotions. So when I'm working with a client, I ask 3 questions. So a client who has trauma. The first question is, what is the core emotion, right? So if I'm feeling really anxious or I'm feeling triggered from my trauma, I'm going to go to what is the core emotion. And so someone might say, I'm angry. That's the emotion. And I'll say, okay, can you go deeper than anger? Because anger is a secondary emotion. So there's always a primary emotion under that. And as we keep going deeper, perhaps it's that they feel alone or they feel out of control or they feel scared. And so once we get to the core emotion, I ask that client, how old is the emotion? When was it created? Well, I was 6 and I felt scared for the first time because my dad left and he didn't come home that night, right? Whatever that was. And so it's getting to the core emotion, but then when it was created and how old it is. Because we have all of these younger selves, right? If you know anything about inner child work, there are these younger selves that come forward when we are triggered, and they are what is reacting. So if my 6-year-old self is reacting, it's not my 38-year-old self. I want to speak to that 6-year-old. So that goes to the third part, which is, what does that emotion need to hear? What does that loneliness or what does that fear need to hear at a 6-year-old level? And so we then begin to process that in therapy. And you cannot heal trauma without accessing your emotions. So when we begin a healing journey in therapy around trauma, I always start with these 3 questions because we're going on a journey. It's not a sprint. And so we need to start with knowing, why do I want to go on this journey? So what are my goals? Why do I want to go on this? Why am I even starting this? What do I want to gain from healing? And what do I want my sex life to look like? So obviously, as a sex therapist, that's where we focus. But basically, what is the picture? What is the ultimate goal that we are going towards? And by taking control of your journey, you can reclaim the power taken from you by trauma. Because when trauma happens, most of the time, what happens is someone or a situation comes in and something happens to you without your consent. And when that happens, your power is taken from you. And so part of the healing journey is helping clients realize how to take back that power, right? How to get closure for themselves, how to process what happened and what their body is holding so that they can then take back the power. Because trauma is always stored in the body, the mind, and spirit when left unfelt and unprocessed. So how do we do this in therapy? These are a couple different techniques that I have personally used as well as recommended to my clients that have actually worked. There's many other options, but this is what I'm focusing on. So guided imagery is a technique that we use. The 3 questions about the emotions that I shared earlier, breathing exercises, right? So when you've experienced trauma, what often happens is we breathe very shallow, like particularly when we're stuck in that trauma or when we're triggered, and it might be like, right? I don't know if you can hear me on the video, but what we teach in therapy then is how to really fill the entire body with breath and release the breath. And this gives you a sense of control, which again, when you've experienced any form of trauma, it often feels like your control and power was taken from you. So even being able to learn how to be intentional in your breath work can help you take back that control. Some of the mindfulness techniques that I use would be, for example, if I experienced trauma in, let's say I had a mastectomy and I experienced that trauma in where my breasts used to be. I would have my client place their hand on that part of their body that holds the trauma and just really focus on what they feel, what they sense, right? Maybe focusing on the warmth of their hand on their chest, focusing on their heartbeat under their chest, acknowledging the body part with touch and words. You know, I'm so sorry that you experienced the trauma of being removed, and I miss you. And I miss the pleasure that you used to be able to give me, right? It's just talking to that body part that's holding the trauma. And then another technique that I use is intentionally breathing a calming color into that specific body part. So again, using the chest. My favorite color is pink. So pink is a calming, centering color for me. So as I would breathe in, I would fill my chest with the color pink. And I hate orange. And so as I would breathe out anything that's trauma related or negative or scary, I would breathe out the orange. And so filling the chest with the pink and out with the orange, releasing the unwanted color, feelings, or energy with your out breath. Another technique that we use, and I have my clients write a lot of letters to themselves, but basically writing a letter to yourself, telling yourself what you deserved, what you needed or need to hear. If trauma happened to you in childhood, it might be writing a letter to your 6-year-old self and saying, like, you deserve to have parents that protected you instead of having parents who ignored you. And by writing to these different parts that were traumatized or that went through the trauma, what we're doing again is acknowledging the trauma. We're working through the trauma. You cannot just keep pushing it away or avoiding it. You have to work through it in order to heal. There's no over, around, under trauma. You have to work through it. Creating a time and a space where a client can intentionally sit with the traumatized parts and then process. I know this is a little outside of the box, right? But I think of the body, each part of the body as its own separate being, right? And so if I experienced trauma in my chest, then sitting with myself in silence and acknowledging my chest, touching my chest, asking it what it needs to say, asking it what it feels. And when you do this consistently, what will happen is these thoughts or words or memories or song lyrics, colors will come to mind. And when those come forward, what we do then is we process those in therapy. So in order to move through trauma, it is often helpful to move your body. So dancing, being in nature, doing art, writing, some people exercise, whatever feels good to the client's body. If we can move the body while we're processing and acknowledging the trauma, that helps it even more than just sitting still and just thinking about it in your head. Because remember, when trauma happens, we disconnect the brain from the body. And so in moving the body while we're using our brain to process, we're connecting the brain to the body. consistency in all of these techniques. Again, these are just some techniques that are used in trauma work, but consistency in these techniques builds trust between the brain and the body and allows reconnection with the body, mind, and spirit. So all of that's great information, but how do I actually use this with clients, right? So the first case study that I'm going to talk about is a client who came to me, and she had been married for 3 years at that point, and had never been able to experience penetrative sex due to pain that she experienced during any form of penetration, whether that was digital penetration or penile penetration. And so she came to me and she said, Drea, I just really want to be able to have a baby, right? And so one of the things that this client had brought with her to the therapy room is all of this religious sexual trauma. So this particular client had grown up in a very conservative Christian home in the middle of purity culture, right? Which was a movement in the evangelical Christian church that really focused on protecting your virginity, on modesty, on not having sex or any form of sexual activity outside of marriage. And so the messages that she had received about pleasure, about her body, about sex, all of that was very shame-based. And again, this was her experience. So I know a lot of people who grew up in that culture did not experience this, but this was hers. And so when she came to me, we had to process all of the messages that she had received about her body and her sexuality and her pleasure. And we realized together that what was happening and what was keeping her from being able to have sex the way that she wanted to is that she was experiencing vaginismus. And so I was able to do a lot of psychosexual education with her on what vaginismus is, why it shows up, how it was really her vagina and her vulva's way of protecting her from what they believed were unsafe based off of the messages, the shameful messages that she had received growing up. And so we processed those messages that she received about her sex, her body, pleasure from her family of origin, her religion, and her culture. And we really began to work through her shame. And shame is the belief that I am bad, right? And guilt is the belief that I did something bad. And so when you work with people who have experienced any form of trauma, there's often guilt or shame that go along with that. I will tell you as a therapist that working through shame for me is much more difficult with a client than it is working through guilt. And this particular client had a lot of shame around her sexuality. And so what we did after we worked through all of that is we began to focus on non-sexual but pleasurable touch. So I made her do a pleasure journal and made her look for what gave her pleasure in her everyday life, whether that was the rain, the sound of the rain outside, or eating ice cream, or petting the cat. She began to look for what gave her pleasure in life. And so going back to what we started our presentation on today, with the purple, right, versus the yellow, is she was so used to looking for purple. And so I was making her look for yellow, making her look for pleasure. And then I helped teach her how to touch her own body and give her own body pleasure. And I taught her how to masturbate. I taught her about her anatomy, about how her body worked when it came to sex and pleasure and arousal and desire. And then once we had done all of that, we brought her partner, her husband, in to a couple sessions, and we began doing what a form of therapy that we use in sex therapy, which is called sensate focus therapy, which is basically techniques that help incorporate pleasurable touch that are not sexual, that are not orgasm focused. And this helped them as a couple work through the sexual pain she had experienced, the vaginismus that she was experiencing. And so they did that together. And in the end, they were able to help her experience pleasurable, penetrative sex. And she's now a happy mom of 2 beautiful children. And so that's how we worked from the beginning of her journey all the way through the end. And I think our journey together was somewhere between, 8 and 12 months. And I was really happy with how that ended up in the end. The second client that I want to talk about today is, I think, a little bit more relevant to you guys because you're in the medical field. But this particular client was in her, I believe, her late 50s. And she was a breast cancer survivor. And she also had cervical cancer. And she had a double mastectomy and a radical trachelectomy and chemotherapy. And so she came to me because she was experiencing pain during intercourse. She had a major lack of sexual desire and a decrease in lubrication. And prior to having cancer and prior to going through everything that she had gone through medically, she had a pretty, what she called, normal libido, where she did experience desire and she did enjoy sex. And after, going through everything that she did in order to become cancer-free, she just felt like a totally different person. And so as we were processing like who she used to be, physically, sexually, emotionally prior to cancer versus who she was now, we began to notice that there was a lot of grief. And I think a lot of people that go through cancer, the focus in the beginning is like, I've just got to get better. I've just got to stay alive. And that's important, but there's so much more going on, right? There's grieving the loss of who we were, the loss of the way that we used to have sex, the loss of what my body used to feel like and look like. And so as we began to process all of this, I realized pretty quickly that she needed pelvic floor physical therapy. And I, as a sex therapist, love pelvic floor physical therapists. They are so important to the work that we do. And so I referred this particular client to pelvic floor PT, where she was taught how to use vaginal dilators. They were able to help her figure out what muscles to relax as she began to learn about her new body and how sex was going to look and feel moving forward. We were able to identify and work through the shame and anger that she was experiencing. She had a lot of anger about the cancer, about how she felt that her body had betrayed her by getting cancer. She also had a lot of anger towards her partner. Her partner was putting a lot of pressure on her to have sex the way that they used to have sex. He really just didn't understand what was going on inside of her body, because in his mind, well, she was cancer-free, so she should be back to normal. And so we really had to process that anger and begin to look at what her new normal was. I did a lot of psychosexual education about spontaneous versus responsive arousal. Focusing on Emily Nagoski's work. She is phenomenal. I always ask my clients to read Come As You Are, which is her book, and it's wonderful. But again, Emily focuses on, sexual context, positive sexual context, for sex versus a negative sexual context. And I was able to help my client see that there was nothing wrong with her libido. There was nothing wrong with the way that she became aroused. It's just that she had gone from being a spontaneously aroused person before cancer to a responsive arousal person after cancer. And once we had processed all of that, we brought her husband in for a couple sessions and incorporated him to process his feelings about, everything that had happened to his wife, about their sex life, about his fear of losing her. And as we processed those feelings, we were able to identify realistic expectations for them as a couple around sex and intimacy. And we began to rebuild what their sex life was going to look like and sound like and taste like and feel like, because what they used to have was no longer there. And so we got to rebuild together what that was going to look like after cancer. We used Barry McCarthy's 5 Gears of Touch to incorporate forms of non-sexual but intimate touch into their relationship, realizing that they weren't going to be able to have penetrative sex as often as they used to before cancer, but there were so many other ways to incorporate, intimate, pleasurable touch that didn't require a penis and a vagina. And then we worked through the physical, emotional, and sexual trauma that came with the diagnosis and treatment of cancer. So I just wanted to make a little public service announcement, since I have a bunch of people in the medical field here today, but I cannot express enough the importance of recognizing and acknowledging the amount of emotional and sexual trauma that cancer survivors can experience with the removal of any or all parts of their reproductive system. Just because a client or a patient is cancer-free does not mean that they are healed. It is a part of their journey, but there is all of this other stuff that needs to be addressed and acknowledged and healed once the person is cancer-free. And there really is a tremendous need for psychosexual education during and after cancer treatment. So, how do you come in as a medical provider and work with someone who's experienced trauma? So when working with patients in a medical setting who have experienced some form of trauma, whether that's emotional trauma, sexual trauma, medical trauma, birth trauma, right? Trauma is trauma. So I think really working on how you engage with that patient is really, really important. So being aware of your own trauma, and or any biases that you might have, or that might come up with you when working with patients who have a history of trauma. As a therapist, I have to do that, but also as a medical provider, I think it's important that you do that. Asking your patients, do they have a history of trauma? Any form of trauma, just so that you can be trauma informed going into working with that patient. Asking how they are feeling emotionally about being at the medical appointment that they're in. Explain what you're going to do to them before you do it. So if you're doing an exam, like, hey, I'm going to start today by, checking your back or whatever. But just letting them know this is what the plan is. This is what I'm going to be doing. And then always asking for consent before touching a patient, or doing a procedure to make sure they feel safe and in control and are aware of everything that is happening to them. And then if something is triggering for the patient, ask if they need to take a break, or if there is something that could help the procedure feel less invasive or overwhelming or scary. Giving that patient permission to say, I need to slow down. I need to take a break. This is too overwhelming right now. I think I might need to do this at another appointment. I need a nurse to hold my hand. And then having a list of providers or groups that you can refer your patients to if they are struggling with any form of trauma. So what does pleasure after trauma look like, right? So allowing yourself to feel pleasure after trauma is one of the hardest parts of this journey, right? Because when you experience trauma, your body is in survival mode. And so in survival mode, all we're thinking about is like, am I safe? Am I going to die? Do I have food? Do I have shelter? Like my basic needs, are those being met? Pleasure is not on that, right? Because if I'm in this whole protection space in my brain, there's no space for me to relax and slow down and experience pleasure. So in order to experience pleasure after trauma, we have to really work on self-awareness, right? What's going on inside of me? What's going on outside of me in my world? What do I need? What do I feel? What's coming up for me? Consistency, right? Consistency in checking in with yourself, in feeling safe, in communication, in creating an environment where I know what's going to happen to me today. Generally, right? Obviously, things happen that we don't plan for, but if I have a routine or I know what's coming today, I'm more able to relax and open up to pleasure. Having patience with yourself and the whole process. This isn't a sprint. This is a journey. Even when you've done all the work, right, on doing trauma or processing your trauma, it's never gone. It shows up differently. It might come up less frequently. You feel more in control of it. But having patience with yourself is really important. Identifying and sitting with your triggers, right? Finding tools that actually work for you when you feel triggered. Like, is it working out that helps me? Is it journaling? Is it crying in the closet? Is it going to therapy? Is it doing the deep breathing? And then your willingness to move through the trauma also is a really big part of embracing pleasure again, because you can have all the tools in the world. And this is something I have to think about all the time as a therapist, is I can give my clients everything that I have. But at the end of the day, it's their job to either use those tools to heal or not. And that is not in my control. So a client's willingness to move through the trauma is very key. So in reclaiming pleasure, humans require the experience of pleasure. Pleasure is part of being human. Emily Nagoski defines pleasure as a process, not a state, an interaction, not a specific area of the brain or the body. Pleasure is the whole flock. Pleasure is all of you. Pleasure is whatever brings you joy and nourishment. Pleasure is a biological guide to what is good for us, like fresh air, clean water, food, rest, movement, touch, and play. So some of the techniques that we use in reclaiming pleasure, and I kind of referenced this earlier in the presentation, but I have my clients write down one thing every day that gives them or gave them pleasure. I often tell them we're going to start a pleasure page, but then it turns into a pleasure journal, right? Because there's so many things. If we actually look for the yellow, there's so many things that give us pleasure. So I have them write those down and intentionally look for what gives them pleasure. And then we intentionally incorporate those things that give them pleasure into their daily lives. I truly believe that pleasure is your birthright. It is not something that must be earned. I think we live in this culture in America where it's like, if I do enough today, if I work hard enough all year, then I get 1 week of vacation, that's my pleasure that I earned, right? But pleasure is not something that is earned. It is something that you are entitled to as a human being. And so I use the ice cream example, like, If you love ice cream and that gives you pleasure, then it's intentionally giving yourself permission to have an ice cream cone and really enjoying the ice cream cone and noticing what it tastes like and smells like, and all of the senses that are triggered and that receive pleasure in eating that ice cream. Identifying what is pleasurable using all five senses, because the five senses, when they are used or focused on, that helps our body really come alive and again connect the brain to the body. We incorporate non-sexual but pleasurable touch with the client by themselves, like learning what kinds of touch I like to give myself, and what I enjoy before, teaching their partner if they have a partner, or incorporating a friend or a cuddle therapist. But really learning about what gives my body pleasure before inviting anyone else to give my body pleasure is important. I tell my clients all the time that you will be your greatest lover that you'll ever have, right? You need to learn about what gives you pleasure and what you like in your own body before you can ever teach anyone else. And then if they do have a partner, then we go right into the sensate focus therapy and techniques that we talked about earlier of really focusing on pleasurable touch that is non-sexual, that is not orgasm focused, that is not penetration focused, but it's all about receiving and giving pleasure. So Stacey Haynes states in her book, Healing Sex, a really great quote. And I know it's kind of long, but I love it. So she says, reclaiming pleasure is like letting water back into a sea sponge that has been dried for years and is hard and crusty. The sponge initially repels the water and then very slowly begins to let it in. First, a little water seeps in around the edges, and then slowly the water reaches deeper into the sponge. Eventually, with a steady supply of water, the sponge becomes supple and pliable again, able to easily let water in and squeeze it out. And what I love about that quote is that when you've experienced trauma, you really do go into that sponge that is all dried up, and we aren't doing what a sponge is meant to do, right? Which is to retain water. And as we begin to let in pleasure, sit with our trauma, begin to do the work and process, what happens is that water begins to come in. And at first it's like, no, I don't want to do that, right? I'm like, when I'm just a dry sponge, I'm safe. But as we let it in, we are able to have this full, beautiful life that we wanted, and do what sponges are supposed to do, which is hold water. So I really love that. Stacey Haynes is a phenomenal writer, and her book, Healing Sex, is one that I use all the time with my clients who've experienced trauma. So this brings us to embodiment. What is embodiment? So unfortunately, there is no consistent or general established definition of embodiment in a psychotherapeutic sense. Somatic psychology asserts that the felt experience of the body and the thoughts of the mind are completely interwoven and interdependent. So awareness of felt experiences derives from three sense mechanisms. So sensing the environment, so what's going on around me, sensing the physical position of your body, what's going on in my body, and then kind of like, how is my body interacting? And then sensing everything and anything you can feel inside your body. Anne Safi Biasetti defines embodiment as living life informed through the sense experience of the body. So how do we learn how to incorporate embodiment after trauma? So some of the ways that I experienced embodiment on my own personal healing journey, and again, I have recommended many of these to my clients as well, is Reiki, which is energy work in the body, craniosacral therapy, sensate focus exercises, masturbation, mutual masturbation with a partner, which really makes you get vulnerable. And vulnerability is really a good healing tool. Massage, guided imagery. A lot of these are, again, combining the body and the brain, right? And that helps us with the embodiment after trauma. So my personal journey with trauma is really what led me to becoming a certified sex therapist and a doctor of clinical sexology. Going through what I went through as a kid, all the way up until I was 18, I realized I wanted to help other people who had experienced similar things to what I had experienced, because I knew that it wasn't okay. Like, this should not be happening to people. And so what's so beautiful about my story for me is that I took this really hard, ugly, traumatizing kind of situation, and I feel like I'm spending my life creating something beautiful from it in helping other people. And so I combine what I have experienced and learned on a personal level with what I have learned academically, obviously, in all the education, the extra, classes in trauma that I've taken, and then professionally. So my journey to embodying pleasure after trauma enables me to educate, encourage, and support my clients on their healing journeys. And I believe that taking life's challenges and using them to help others is the greatest gift that I have to give. And so that is what I have today for us about embodiment of sexual pleasure after trauma. And these are all my references. So thank you so much for listening today. And if there's any questions, you guys are welcome to, I'm not sure how this works, but like, you can email me. My email I can give to the people in charge, and you're welcome to email me any questions that you might have. Thank you for your time. And yeah, thanks.